Hello, I'm Dr. Brad Schaefer, Section Chief of Genetics at the University of Arkansas for Medical Sciences and Arkansas Children's Hospital. I'm here with Dr. Golnar Kam, a pulmonologist at Arkansas Children's Hospital, to discuss newborn screening for cystic fibrosis in Arkansas. We hope this video will provide important information for parents and providers after a child has had a positive newborn screen for cystic fibrosis. The newborn screening program in Arkansas screens for hearing loss and many conditions, and cystic fibrosis is one of these. Newborns are screened for these conditions by getting a heel stick, and that blood sample has been sent for testing. This is a screening test, and further testing is needed when there's a positive newborn screen. Our goal is for all babies to receive a newborn screen, and for more information about newborn screening in general and the other conditions we screen for, please look at the www.healthyarkansas.com website.
As Dr. Schaefer mentioned, every newborn in Arkansas is screened for cystic fibrosis. Cystic fibrosis is a disease that affects the lungs and the digestive system as well as other organs in the body. Screening for cystic fibrosis, or CF, is important so we can identify children with this disease early in life and start treatment as soon as possible. The pulmonary section at Arkansas Children's Hospital works closely with the genetics team, the Arkansas Department of Health, and your baby's primary care physician to follow up on babies with a positive cystic fibrosis newborn screen. Every child with a positive CF newborn screen should undergo sweat chloride testing or sweat test to determine if the child has the disease or is a carrier of the CF gene. The sweat chloride test should be done at a CF center which is accredited by the National Cystic Fibrosis Foundation. Arkansas Children's Hospital is the only accredited center in Arkansas. Most babies with an initial positive CF newborn screen are diagnosed as carriers. If the baby is diagnosed with CF, then we arrange a clinic visit where the child is evaluated by the CF care team and the family receives education about CF. This video will take you through talking with parents about a positive CF newborn screening, obtaining a sweat test, and follow a baby with a positive sweat test through their first clinic visit with the CF care team. We hope you will find this video helpful.
At this time, you may have been contacted by your primary care physician or the newborn screening coordinator at Arkansas Children's Hospital to discuss your child's newborn screening results for cystic fibrosis, or CF for short. Your child was found to be a carrier of at least one change in the CF gene, which means that your child might have cystic fibrosis. Since newborn screening is solely a screen, an additional test called a sweat test is required to confirm or to rule out if your child has cystic fibrosis. The newborn screening coordinator will contact you to arrange a sweat test, which must be performed at an accredited CF center. Arkansas Children's Hospital is the only accredited CF center that performs sweat tests in Arkansas. As you prepare for your visit, please refer to this website for directions and tips. Once you arrive on campus, you'll need to check in at the General Pediatric Clinic. At check-in, we're going to measure your child's height, weight, and temperature. And a nurse will take you to the pulmonary lab for the sweat test. Please plan on being there for about 3 hours. To make your visit more comfortable, here are some helpful tips to keep in mind. We'll need your baby to be well hydrated for the sweat test, so please keep your regular feeding schedule and don't skip a feed. Bring plenty of baby formula if bottle fed, and bring burp cloths or any other necessities for your child's feeds. Bring extra diapers and a change of clothes for your baby. We know this can be a long visit and you may want support, so family members are welcome to attend. A sweat test measures the amount of salt in your child's sweat. High concentrations of salt present in sweat can confirm a diagnosis of cystic fibrosis. The sweat is collected through a painless process where a chemical is placed on the arm and a mild electric current is briefly used to stimulate sweat production. The sweat is collected on a piece of gauze and taken to the lab. The sweat test takes about an hour to perform. You may stay with your child throughout the test. Once the test is complete, results are typically available within an hour and will usually be discussed with you the same day of your appointment. If your child has a negative sweat test, it's likely they are a CF carrier. Now, this means that your child has been found to have one changed copy of the CF gene. The newborn screening coordinator will meet with you to discuss these results and what they mean. Genetic counseling is always available if you have questions. If your child is only a carrier, your child will not have future complications related to cystic fibrosis. Your child should grow fine without any complications related to being a carrier of a changed CF gene. However, it is important to know that once your child is grown and has children of their own, there is a chance they might pass on the same CF gene to their children. For more detailed information, please see the Information for Caregivers handout on the website. When a child has a positive sweat test and changes to the CF gene, then that child will have a diagnosis of cystic fibrosis. The newborn screening coordinator and a genetic counselor will meet with you to discuss these results and what they mean. You will also meet with a pulmonary specialist and the CF team. You will learn the cause of cystic fibrosis, how it might affect a child, the chances it might happen again in your family, and next steps of care. Sometimes additional follow-up is needed after a sweat test. This can happen if there was not enough sweat to complete the test, or the test was inconclusive, or your child has two changes to the CF gene. The newborn screening coordinator and genetic counselor will meet with you to discuss these results and what the next steps may be. Sometimes further testing is needed. This might include repeat sweat tests or additional lab work on your child's blood. Sometimes we also need to test the parent's blood to help with the diagnosis. When a child has changes in both copies of the CF gene, or a child has sweat tests that cannot rule out cystic fibrosis, this child may be diagnosed with CRMS or CFTR-related metabolic syndrome. The newborn screen coordinator and genetic counselor will meet with you and discuss what this means for your child. Depending on the test results, your child may require additional appointments with a specialist, such as the pulmonary specialist or the CF team. These are typically arranged on the same day of the sweat test for your convenience. For more information about CRMS, please see the handout on the website. Next, we'll meet some families who can share their experiences with the newborn screening process. We understand this can be a confusing and stressful time for families. We hope this video has helped your family understand what to expect in the coming days or weeks.
Our experience on first meeting with our local CF team here at Children's was a good one. Even though we've met them on that very long day, it was nice to know that he had a very particular set of doctors, nurses, respiratory therapists that were really catered to him and his needs and us as a family. We've gotten to know them throughout the months of visits every month, and we feel like they've gotten to know us. The CF Foundation has a wonderful website with lots of information, lots of videos, even videos tailored to parents with the new diagnosis. That was really helpful for us to get on there and read, to see some success stories, to see some patients who were diagnosed early on and who have lived a full life. It's easy to get wrapped up in the diagnosis and the things that may happen or could happen in the future, and you end up missing a lot of the things that are going on now. As a 15-day-old baby, you miss some of the baby noises or the moving of the fingers or the wiggling or all these things that you forget are going on right now because you're too busy projecting things that aren't a certainty on your child's future. So just be very patient and make sure you're in the now and not in the future with your child.
Alex is your typical little boy. He loves to play, he goes fishing, we go out and play ball in the yard all the time. He is just like any other 2-year-old in his activities, his interests, and he has cystic fibrosis. But emotion aside, it's a fact of life, and it really hasn't changed anything that we do in our lives other than the additional therapy or the medical care that we provide him. But without that, he might have issues, but with it, he's just any other little boy.
So when I first realized that we had a child who had cystic fibrosis, one of the first things that was very helpful to me was to ask myself, what is still true about my child, myself, and my family that has not changed despite this diagnosis? And there was a lot. There was a lot more that was still true and still every bit as much as what I thought it would be about Alex and myself and Jeremy and our family than anything else. And I have just seen that that's remained true. You know, it's just as true today as it was when he was a baby.
The process after learning that Colin had cystic fibrosis was pretty simple. Everyone at Arkansas Children's Hospital set our appointment up every week. We came back after his positive newborn screening and had his sweat test. After his sweat test and we got a definite confirmation that he had cystic fibrosis, we came back every week for a month and we learned how to administer enzymes and how to mix his formula and how to do his chest therapy. And after that, it went to every month. We came back every month for the first year of his life, which was also very easy. The appointment center just set up our appointment every month and we just came. We stayed in touch with the CF team and they equally stayed in touch with us. We never felt alone through the whole process. We did receive phone calls just checking on us and making sure we were doing okay. Not Colin, but the parents, so that was really impressive. 3 years ago, we didn't know what to expect for Colin's future. We were worried about, would he play with other kids? Would he go to school? Would he play on sports teams? And how would his day-to-day life be? Today, he is 3.5 years old. He plays soccer. He is in gymnastics. He is very active. He's very smart. And cystic fibrosis is just part of his life. It is important to know that the newborn screening is a really great thing. It keeps you from being misdiagnosed for years. It can save your child's life. It did save Colin's life.